Hi, I'm Dr. Eric. I wanted to take a minute to discuss with you some of the other things that could be causing numbness or tingling or pain that radiates into either the upper arm or the legs. As discussed in our article, there are lots of different things that can cause this, from nerve entrapments down the chain to disc herniations and things of that nature. Something we treat a lot at the office though is what we call muscular referral that comes from trigger points, most commonly is known as knots in the area. So when it comes to hands or carpal tunnel specifically, there's a lot of different areas up the chain that we can look at that could be causing this. So when we have a patient here, what we want to do is we want to take the arm out and create pressure on these different areas where that could be coming from. First one we want to look at is the pec minor, which is the little muscle that runs underneath the large chest muscle. So it'd be here. If pressure recreates symptoms, it's something that we'd want to work on and release that area with some of the different modalities we offer here. Coming down the chain though, we can also look at a muscle called our pronator teres that runs right in the front of the forearm. And what happens is the nerve that runs down to the hand can get irritated from the tightness or this irritation that has caused these knots to build up in those areas. If I'll have the patient flip over for me. Some other spots that can refer pain down into the arm are actually our upper trap here can create a knot, or there are a couple areas in the rotator cuff muscles where we can compress and see if those recreate the symptoms. Again, symptoms are recreated. It's something we can attack with some of the different modalities that we have here. Now, when it comes to sciatica, that's another one that we work on a lot that can have some muscular referral as well. And there are actually two muscles down in our glute that can have this. The first is our glute medius, which is a muscle that runs from the sacrum on the top of the hip. And then the other one is the piriformis, which runs from the sacrum a little more down and across to the side of the hip here. And what we can do to distinguish these between a disc herniation or something up in the spine or muscular referral is, again, create pressure on the area and see if it recreates or reduces the symptoms that the patients are having. Point of my story here is that it's very important to get proper diagnosis and assessment when it comes to symptoms that can be in the arms and legs.